Noni fruits, a knobby, pungent-smelling fruit native to Southeast Asia, Australia, and Polynesia, has been revered for centuries in traditional medicine systems for its extraordinary healing properties. Often referred to as cheese fruit due to its strong odor and bitter taste, Noni is a staple in Pacific Island, Ayurvedic, and traditional Chinese medicine, where it is used to treat ailments ranging from infections and inflammation to chronic diseases like diabetes and cancer. Despite its unappealing sensory profile, Noni's nutritional and phytochemical richness has garnered global attention, with modern science increasingly validating its traditional uses. Packed with iridoids, flavonoids, lignans, and unique compounds like damnacanthal and scopoletin, Noni offers a multifaceted approach to health, targeting everything from immune function and cellular repair to metabolic balance and mental well-being. However, its high potassium content and potential interactions with medications necessitate cautious consumption, particularly for individuals with kidney disease or those on certain drugs. This comprehensive exploration delves into the science-backed health benefits of Noni, unraveling how this ancient fruit bridges traditional wisdom and contemporary health paradigms while addressing its limitations and risks. Noni's immune-boosting prowess stems from its rich array of polysaccharides, vitamin C, and bioactive compounds like scopoletin and damnacanthal. Polysaccharides in Noni stimulate the production and activity of macrophages, neutrophils, and natural killer (NK) cells, key components of the innate immune system that identify and destroy pathogens. Vitamin C, though present in moderate amounts, about 34 milligrams per 100 grams, synergizes with Noni's antioxidants to neutralize free radicals, reducing oxidative stress that weakens immunity. Scopoletin, a coumarin derivative, exhibits antimicrobial and antiviral properties, inhibiting pathogens such as Staphylococcus aureus, Escherichia coli, and herpes simplex virus. Studies also suggest that Noni juice enhances interferon gamma production, a cytokine critical for antiviral and anti-tumor responses. Traditional Polynesian healers use Noni to combat infections and fevers, a practice supported by modern research showing its efficacy in reducing bacterial load and inflammation during illness. For immunocompromised individuals or those seeking preventive care, Noni can serve as a natural adjunct to bolster immune resilience, though it should not replace conventional treatments. Chronic inflammation underpins diseases like arthritis, cardiovascular disorders, and autoimmune conditions. Noni's anti-inflammatory properties are attributed to its iridoids, e.g., asparagine, flavonoids, quercetin, rutin, and scopoletin, which inhibit pro-inflammatory enzymes like cyclooxygenase, COX-2, and cytokines such as tumor necrosis factor alpha, TNF-alpha, and interleukin-6, IL-6. In clinical trials, Noni juice significantly reduced joint pain and swelling in arthritis patients, comparable to over-the-counter analgesics, but with fewer gastrointestinal side effects. Its analgesic effect is linked to the activation of opioid receptors and the inhibition of prostaglandin synthesis, pathways targeted by pharmaceutical painkillers. Traditional users applied Noni pulp topically to soothe burns, wounds, and gout, leveraging its cooling and anti-edema properties. For athletes or individuals with chronic pain, Noni may offer a natural alternative to manage discomfort, though its potency varies with preparation and dosage. Noni's anti-cancer reputation, rooted in Polynesian folklore, is increasingly supported by laboratory research. Damnacanthal, a bioactive anthraquinone in Noni, inhibits the RS signaling pathway, a driver of uncontrolled cell proliferation in cancers like leukemia and breast cancer. Noni's polysaccharides and flavonoids also induce apoptosis, programmed cell death, in cancer cells while sparing healthy cells, a selective mechanism crucial for reducing chemotherapy's collateral damage. In vitro studies demonstrate Noni extract's efficacy against colon, lung, and cervical cancer cells, with animal models showing slowed tumor growth and metastasis. Additionally, Noni's antioxidants protect DNA from mutagenic damage caused by carcinogens like tobacco smoke and UV radiation. Human trials remain limited, but population studies in noni-consuming regions report lower cancer incidence, particularly for liver and breast cancers. While not a standalone cure, noni's chemopreventive properties make it a promising dietary adjunct in oncology care, warranting further clinical exploration. Noni's role in glycemic control is linked to its ability to enhance insulin sensitivity and protect pancreatic beta cells. Compounds like scopoletin and quercetin activate AMP-activated protein kinase, AMPK, an enzyme that improves glucose uptake in muscle cells and suppresses hepatic glucose production. Animal studies show that noni juice reduces fasting blood glucose levels and HbA1c, a marker of long-term glucose control, in diabetic models, comparable to metformin. Its high fiber content, 5 to 7% by dry weight, slows carbohydrate digestion, preventing postprandial spikes. Traditional healers prescribed noni for sweet urine conditions, now understood as diabetes, with modern trials confirming its anti-diabetic effects. However, diabetic patients on insulin or sulfonylureas should monitor blood sugar closely, as noni may potentiate hypoglycemia. Noni supports heart health through multiple mechanisms, lowering blood pressure, reducing cholesterol, and preventing oxidative damage to blood vessels. The fruit's scopoletin acts as a vasodilator, relaxing arterial walls and improving blood flow, while its potassium content, almost equals 190 mg per 100 g, counteracts sodium's hypertensive effects. Noni's fiber and phytosterols bind to LDL cholesterol in the gut, promoting its excretion and reducing atherosclerosis risk. Antioxidants like vitamin E and selenium prevent LDL oxidation, a key step in plaque formation. Clinical studies note that daily noni consumption lowers systolic and diastolic blood pressure by 5 to 10%, akin to low-dose antihypertensives. However, individuals on blood pressure medications should consult doctors due to potential additive effects. Noni has been traditionally used to treat jaundice and liver disorders, a use validated by its hepatoprotective properties. The fruit's antioxidants, particularly damnacanthal and quercetin, mitigate toxin-induced liver damage by neutralizing free radicals and enhancing glutathione, the liver's master antioxidant, production. Studies show noni extract reduces elevated liver enzymes, AST, in alcohol-induced liver injury models, promoting regeneration of hepatocytes. Its diuretic effect aids in flushing out toxins, while antimicrobial compounds combat hepatitis viruses. For individuals with fatty liver disease or toxin exposure, noni may support hepatic function, though those with severe liver conditions should seek medical advice. Noni's antimicrobial, anti-inflammatory, and collagen-boosting properties make it a potent ally for skin health. Topical applications of noni juice accelerate wound healing by stimulating fibroblast activity and angiogenesis, new blood vessel formation. Its antibacterial compounds, like acubin and L-asparagine, prevent infections in burns and ulcers, while antioxidants reduce scar formation by inhibiting excessive collagen deposition. Noni oil, rich in linoleic and oleic acids, hydrates the skin and improves elasticity, making it popular in cosmetics for treating eczema, psoriasis, and acne. Oral consumption of noni may also reduce systemic inflammation linked to skin conditions, though direct topical use shows more immediate benefits. Noni's neuroprotective effects are attributed to scopoletin and serotonin precursors, which modulate mood and cognitive function. Scopoletin inhibits monoamine oxidase, MHO, an enzyme that breaks down neurotransmitters like serotonin and dopamine, potentially alleviating depression and anxiety. Animal studies suggest noni improves memory retention and reduces amyloid beta plaques in Alzheimer's models. Traditional users consumed noni to relieve stress and enhance mental clarity, a practice supported by its adaptogenic properties that help the body cope with physiological and psychological stressors. Noni's fiber and enzymes aid digestion by promoting bowel regularity and balancing gut microbiota. The fruit's laxative effect, driven by anthraquinones, alleviates constipation, while its anti-inflammatory compounds soothe conditions like gastritis and IBS. Noni's prebiotic fibers feed beneficial gut bacteria, enhancing SCV production for colon health. However, excessive consumption may cause diarrhea, necessitating moderation. Despite its benefits, Noni poses risks for certain populations. Its high potassium content, up to 56% DV per cup, can exacerbate hyperkalemia in kidney disease patients. Alkaloids in Noni seeds may be toxic in large quantities, and cases of hepatotoxicity have been reported in excessive consumers. Pregnant women should avoid Noni due to potential uterine stimulation, and those on anticoagulants or antihypertensives must monitor for interactions. Noni fruit stands as a testament to nature's pharmacopoeia, offering diverse health benefits validated by both tradition and science. From immune enhancement and cancer prevention to metabolic and cognitive support, its phytochemical richness addresses modern health challenges holistically. However, mindful consumption is crucial, particularly for vulnerable groups. As research evolves, Noni may secure a broader role in integrative medicine, embodying the synergy between ancient wisdom and contemporary health innovation.